virtual town hall provided by the Valley Health Alliance and all of our partners and stakeholders. So we're very excited to talk to you, our community, about what's going on within the healthcare system here in our community, and what we're trying to do to reduce the cost of care and improve access and improve quality. My name is Chris McDowell. I'm the Executive Director of the Valley Health Alliance, and we're so excited to have this opportunity to share our work. And we're very thankful for the Chambers for allowing us to host this event on their Facebook pages. And we thank everyone for participating that's here. This should allow you to provide some questions in the comments area. And we'll get to that. Initially, we'll have some panelists share their perspectives and their particular areas of expertise. And then we'll have some time to answer questions from the group. To introduce the panel briefly, Michelle Walker is with us from Rocky Mountain Health Plans. Dr. Gary Knaus is our Clinical Advisory Board Director on our board of directors, and he's also a physician here in our community who's been engaged and involved in a lot of this work. We're very thankful to have him today. Andrea Stewart from the Carbondale Chamber of Commerce. Andrea, thank you for being here. Scott Belitho from Glenwood Insurance, and Sylvia Santana from Mountain Family Health Centers. This should be a really good opportunity. It's our second annual Facebook Live event. We did it last year. We were kind of introducing everybody to the new insurance options in our community. Having two options instead of just one was kind of our feather in our cap for last year. This year, we're going to have lower prices, lower opportunities, more opportunities for lower price in terms of premiums, and also, again, the improved quality in our healthcare system by having more accessible, affordable, and higher quality care. On the front of Rocky Mountain Health Plans, we're going to turn over to Michelle Walker, and she's going to share with us what's new.
All right. Thank you so much, Chris. So everyone, last year at this time, I was able to present to you and introduce the new Rocky Mountain Valley products that we started in 2021. We've been working together with Rocky Mountain Valley, the Valley Health Alliance, the hospitals and physicians now for almost 2 years, and really proud of the product that we have available now in the community. We have been able to present the lowest priced option for folks that are living in the Roaring Fork area, and pleased to report that we have over 3,500 members who enrolled with us for 2021. For 2022, really proud to say that the hard work that we've put in is paying off again. Not only are our rates going to be lower than other carriers in the market, but we're also seeing about a 6% reduction in the premiums over what people are paying today. So this product is proving to be sustainable and growing exponentially. I do expect that we're going to see more growth next year. We're going to be introducing some new products. Last year we didn't have any HSA eligible plan designs. We're able to have those this year. We've got those in the bronze and the silver metal levels. These plans also are lower priced than other carriers in the market. So looking forward to folks getting out there, shopping, looking at these new plans. We know that the state-based exchange is going to open up here for shopping probably by the end of the month. And from there, you guys can all go out and look, see for yourselves how competitive these plans are. Also, there's quite a bit going on at the state level, working to find ways to make care more affordable, more accessible, as Chris mentioned early on. With the collaboration that's been going on locally with Rocky Mountain Health Plans, with the Valley Health Alliance, the physicians, and the hospitals, I think we are very well situated to meet the demands that are going to be placed on carriers and health systems going forward so that we can achieve lower price, better access to care, and more comprehensive care. And right now, I think we're doing that. So I know that Sylvia is going to be talking with you shortly about some of the options and availability of lower priced care, lower priced premiums through the marketplace. So in addition to these low premiums, I think through Connect for Health, our state-based exchange, community members are going to find that they're going to get even more financial help. And Sylvia will talk a bit about that. So thank you, Chris. That's what I had today.
Gary?
Hello, I'm Gary Knaus. I'm on the VHA board and a member of the clinical group and medical director. I want to just, we are always, it's so fun to talk about the VHA. We're excited to talk about it. Some of the things that Chris mentioned, I think we have a unique partnership in a special place. We have engaged employers, large employers, government agent employers, and especially small businesses involved in our board of directors. We're lucky to have 3 engaged community hospitals with very strong leadership. We're seeing new cooperation among those 3 hospitals all the time, sharing services and that sort of thing. We also have an engaged insurance partner, homegrown, Rocky Mountain Health Plans, and we have a strong primary care base, both philosophically and with strong primary care providers throughout our communities, from Aspen to Parachute. We think those are the elements that are key to having a successful health plan. I want to talk just a minute about the importance of primary care. What is primary care? How do we do what we do? Just to put some of that in perspective. We have known for a long time that patients who have an identified primary provider have better health. They have better engagement with the health system, and they have better health security. We also know that health plans who have a strong primary care base across the board have better quality, have less cost, have more patient satisfaction. And so we've chosen to have that as our underpinning for the Valley Health Alliance for these health plans. And I think we're starting to see some great success with that in terms of these prices coming down. What is primary care? We intuitively sort of know that, but I'll just say it's our initial source of contact in the healthcare system. Developing an ongoing relationship with a provider, and many of these providers and their organizations, they're trained and they set up systems to be kind of a one-stop shop. We are trained to provide 80 to 85% of the healthcare needs that someone encounters. This is family medicine, internal medicine, pediatrics, OBGYN. Those are the primary care providers in our community. A lot of these are physicians, but we've got a very strong contingent of advanced care providers, PAs, nurse practitioners, and nurse midwives in our system. So we cover a broad range of those things. How do we do what we do? What are the important elements? Probably the first thing is access. we want people to get the right care at the right place. And we design our systems for same-day access, for telemed, for that sort of approach, and getting people in at the right place when they need to get in. We have a strong emphasis on coordination of care. Healthcare system is a complicated place, and we are the patient's advocates. We help them through the healthcare system, whether it's referral to limited specialist, whether it's imaging, all of that kind of thing, and we coordinate that care. We have a strong emphasis on taking care of people in a family and a community context. We have an emphasis on preventive care, all of those things that try to keep people healthy and engage. We have almost all of our practices have integrated behavioral health and social workers. Mental health is a critical part of how we keep people healthy. We have integrated pharmacists in our practice. And we are continually looking at data. We are looking at what we do. I know which of my diabetic patients needs more education and more work. I know which of my hypertensive patients need follow-up. We are always reaching out outside the medical visit to help manage people and people's problems and help them with that. In summary, we bring all these elements together. We're always looking at data. We're trying to improve systems. We're sitting at the same table with the hospitals, the insurance companies, the employers, and trying to make this work. As I was thinking about this morning, as we all know, COVID has been a challenge, at least, but it's also been an incredible opportunity. We have been working full-time, designing new systems around COVID, and it just has energized us, and we have so many ideas of where we can improve costs, where we can improve quality, and I think we're all reinvigorated despite all of the stresses of that. Hope that gives people an idea of what we're trying to do here. Thanks.
Thank you so much, Gary. It's always good to hear from you and about the experiences of our primary care community. For us at the Valley Health Alliance, primary care is the key for success. They found nationwide, if you invest 10% more in primary care, you get 20% savings throughout the whole healthcare system. Just better utilization, better guidance, better advocacy, more affordability, timeliness, all these things that we look for and that we always talk about. And then next up, we'd love to hear from, who do we have here? Is it, Andrea? Good to have you.
All right. Sure, thank you. My name is Andrea Stewart. I'm the Executive Director at the Carbondale Chamber of Commerce, which is home to over 450 Carbondale Chamber members. I also serve as Chair of the Association of Colorado Chambers of Commerce, which is a nonpartisan entity of the Colorado Chamber. And the chambers throughout the Valley really work closely with the Valley Health Alliance to support the efforts of IHA and also to provide, the local health insurance options for the businesses in the greater community. And we are definitely involved at the board level on the VHA. Debbie Braun, actually, of the Aspen Chamber serves on the board, which is great to really provide that liaison communication between the chambers and also the Valley Health Alliance. The website has great resources and different tools to find local brokers and healthcare providers all the way from Aspen to Parachute. And I really wanted to touch too, some of you may be exploring the opportunity of adding health insurance options to your employee benefit package, especially during this current workforce clients. So this may be an opportunity to explore these options and then also to retain current employees and also bring on new employees. And if you have questions, or if you're actually a local broker that is not yet connected with the Valley Health Alliance, feel free to reach out to your local chamber or also to the Valley Health Alliance and we can connect you. And I know that more information will be added later in the program, but the Valley Alliance, their program is 970-704-8015. Thank you so much, Chris.
Thank you so much, Andrea. It's always nice to hear from you as well, as you represent the community of small business, which is a huge priority and one of the main focuses of the VHA and why we were formed in the first place. And we hope we continue to add value, particularly for our small businesses. Next, we'll have a little more conversation around that with Scott Belitho from Glenwood Insurance.
Thanks, Chris. And appreciate the opportunity to talk about the insurance programs that are going on coming up in 2022. We're not going to see a lot of changes in what's being offered. That came last year through the Valley Health Alliance and bringing Rocky Mountain Health Plans in, and the Navigate plan through United Healthcare on the group side. So on the fully insured marketplace for small group, which is 2 to 100 lives, we have Anthem Blue Cross and United Healthcare. Both of them offer the HMO version and the PPO version. And the biggest difference on the HMO side is that you are more restricted on your ability to have any out-of-network services. In most cases, you don't have any out-of-network services unless it's an emergency situation. So you have to be aware of that. You do have to stay within those networks or you don't have any coverage. The trade-off on that is that you do have a lower price on the premiums for that. And in our Valley, thanks to the Alliance and our local physician community, we have a very, very good network of doctors and hospitals throughout the Roaring Fork and Colorado River valleys. It's also really strong on the Front Range as well. There are a couple of hospitals that don't participate, but when you're talking to your broker about that, you can get into those details. The other nice thing is that multiple plan designs can be chosen to offer to your employees if you are offering group health insurance. So you can combine an HMO plan through United Healthcare, for instance, on their Navigate plan, and add PPO plans if you wanted to give your employees a broader variety of choices. And you can also have a copay plan and a health savings account eligible plan thrown in there so that you're not tailoring it, or you can tailor it to your people and not have just one option. Another option that we have available for small groups are what we call level funded plans, and companies like Aetna, United Healthcare, Anthem Blue Cross, National General, things like places like that, and then the Contractors Health Trust offer these level funded plans. And they are medically underwritten. They're not guaranteed issues. So you have to be aware of that. And a group could actually be declined. But if they do qualify, there's a high probability that they'll be offered premiums that are quite a bit less than a fully insured plan. So we want to let you know that those are available to a lot of the clients in the Valley. They do share in your claims experience, both good and bad, so that if the claims pool has some money left over at the end of the year and you've had a good experience that year, you will get a return of premium. Some of that claims fund will come back to you in the form of credits for your next premiums throughout the following year. They offer very good networks in our area and all across the country too. So what are the rates going to look like next year in January? For those group plans on the fully insured marketplace with Anthem and United Healthcare, we're starting to see those January 1 renewals, and we're seeing anything from about 4 to 8% for most of the plans, and some a little bit less and some a little bit more. But we are really, I don't know how excited you can be about an 8% rate increase, but when we compare that to what we were seeing in the past at the 20, 30, and sometimes even 40% rate increases, that is a very good thing. So anytime we see something at less than 10%, we're excited about that. We're happy, and we can figure out ways to maybe alter some plans a little bit and change things around and keep those rates respectable. HMO and the PPO versions, like I said, are about 8 to 10% less in costs than the PPO plan. So it does give you a pretty good option there as well. We also, for small businesses, have what we call ICHRA, the Individual Coverage HRA Plan. And it does make sense for some clients. Now, this is fairly new. We don't have a lot of clients in here, and we are working on platforms, working with third-party vendors to help implement these ICHRAs for small groups. And basically what it is, the employer sets up the plan, puts in a certain contribution for the employee, and then the employee is able to go out and, through that health reimbursement arrangement, purchase individual insurance on a quasi-group chassis. So those are all done through Anthem and or Rocky Mountain Health Plans on the individual policy through their HMO policies. It belongs to the employee and not to the employer. So the employee has a lot more control over that and what they choose and what they want to have. It can be cumbersome to set these up, but they definitely have a place depending on your own personal situation in your business. Finally, for you business owners who don't have plans or are setting up something or considering this, how do you learn about that? There are many very good and excellent brokers throughout the Valley who work with these employer-based plans. We have competition daily with all the different agencies in the area, but it's a good relationship that we have with each other. And we really do respect the expertise and the knowledge that each of the brokers brings to our clients and to the table for you. So reach out, talk to your broker. If you don't have one, find somebody that you feel you can have a good relationship with and start looking into these, and they'd be glad to help you. So Chris, that's it. Thank you very much.
Scott, thank you so much. Sure appreciate your insights, your influence, and your help in the community. You've been a real advocate for the consumer, and something we could all take from as being our role model. I really appreciate it, Scott. Next up is another huge influence in our community that a lot of people that need help with insurance, and Sylvia Santana has been doing this for a while now, and she works with Mountain Family Health Centers, and we're real happy to have her and to share her perspective and expertise, and particularly helping those that need help getting insurance. Sylvia?
Hello, good afternoon. Once again, my name is Sylvia, and I am the Outreach and Enrollment Manager for Mountain Family Health Centers. And Mountain Family Health Centers is a qualified health center committed to improving the health of our community. It provides equitable and affordable medical, behavioral, and dental health care for all in our community. As of today, Mountain Family Health Center serves over 21,000 patients across the Eagle, Pitkin, and Garfield counties. Now, Mountain Family Health Centers believes in removing that financial barrier to care. And as such, all of our clinics have health coverage guides, and the health coverage guides are available to assist with the health insurance enrollment process. Individuals and families who do not have otherwise access to health insurance can choose a plan on the individual market exchange. Open enrollment does begin on November 1st, and it does end on January 15th. But if you do want your plan to start on January 1st, individuals or families need to enroll by December 15th. Like everyone has mentioned, we don't have really any changes to companies' health plans and for the 2022 coverage. So we're looking at Rocky Mountain Health Plans and Anthem for our coverage area. And the good thing is that thanks to the Affordable Care Act, our consumers are not able to be denied based on pre-existing conditions. The other thing that came out of the Affordable Care Act is these plans on the exchange do offer minimal essential benefits that include preventative, mental health, and emergency services. If you're looking for a complete list of what the essential benefits are, you can go to connectforhealthco.com and get the complete list of what's included in the plans offered through the exchange. Connect for Health Colorado, which is who we are certified, the health coverage guides, is the only place where individuals and families can go in to apply for financial assistance. This year, there's actually more help than ever before, and the assistance is offered through what is called an advanced premium tax credit, known as APTC, or cautionary reductions, known as CSR. the advanced premium tax credits helps individuals and families lower their monthly premium for the cost of health insurance. And the cost sharing deduction helps with the out-of-pockets, which lowers the deductibles, the co-pays, and the co-insurance for those plans. You are able to find help. We do have different assisters and brokers who can assist you through the enrollment process. If you go to connectforhealthco.com and you go under help, and you can either find an enrollment center, a broker, or an assister near you to assist you through enrolling through the Marketplace Exchange. Now, even though there is help out there and the Affordable Care Act expanded the Medicaid in our state, Mountain Family still has a 43% uninsured patients that we serve. And based on the Colorado Health Institute report, our counties, our Tri-County area, have a 59% eligible but not enrolled in advanced premium tax credits, and a 29% eligible but not enrolled in Medicaid. As you can see, there's still a lot of work to be done. And you can help us by spreading the news, spreading this information, so that making sure that folks don't leave money on the table, making sure that they find an assister, which they can go again to connectforhealthco.com and find either an assister, a broker, or an enrollment center for help. Thank you.
Sylvia, thank you so much. The work you're doing is so important for our community. Thank you. It's a difference maker. And again, thank you to each one of you for taking the time to be part of our panel. We're going to move into questions here in a second, but I just wanted to take a brief moment to share about who the VHA is. For those of you that don't know, the Valley Health Alliance is made up of members from 6 self-funded employers: Pitkin County, the City of Aspen, SCICO. Jim Lang was to be with us today. Unfortunately, technical difficulties did not allow him to join us, but he's our board chair, and I'm very appreciate working with Jim, and he's a huge influence in the success of our effort. The other 3 organizations are Aspen Valley Hospital, Valley View Hospital, and Grand River Hospital. And the reason that's important, they're all at the table as employers. And the key to this success of our work comes from that relationship between the employers and the providers in the primary care community in particular. The work of this group has been 9 years now, and we're really starting to finally see a benefit of all the work that we've done and all the key stakeholders in creating accessible, affordable, high quality care. And we're making a dent. It's kind of nice to finally see year over year, particularly in the Rocky Mountain Valley plan. There's a few plans that are going to be cheaper than 2021. So that's the first time in the 20 years I've lived in this community that has happened, that I can remember anyways. It may have happened before, but I don't remember it. But I do want to give credit to our members, also to the chambers. The chambers are key: Aspen, Basalt, Carbondale, Glenwood, Western Garfield County, Rifle area. They are all key to our success, all these key partners. Also very appreciative of the Aspen Community Foundation. A lot of the work, particularly in the small business and individual marketplace, has been supported by the Aspen Community Foundation, and I'm very thankful and appreciative of their participation and support of the Valley Health Alliance. What's new for this year? As you can see, there's still more plans. Things are changing. I think you'll still see, with the public option becoming a huge influence on the work that everybody's doing, you'll see the value there. And then Rocky Mountain Valley is also having an impact around the state, not just here in our community. So we're influencing and having an impact on the entire state of Colorado. But for us at the Valley Health Alliance, our focus is Parachute to Aspen. We also have a website that's becoming more and more useful, hopefully, for each of our groups that are involved, and for you as a community member or business, rvha.org. I encourage you to look at it and find and learn new things. The key points I always want to say when I talk about the Valley Health Alliance, and I've been with the organization for over 4 years now, it's a partnership between employers and providers, and access, quality of care, better process and outcomes. Healthcare has always been about providing services for so many years, And now it's about making people healthy and keeping them healthy and preventing them from getting ill. That's really a shift that I think we've seen in our community. Also, we want to enhance all the work we do is to enhance the relationship between each individual and their doctor and their primary care team, we like to say. All the clinicians that make up that team, as Gary shared nicely. And we're always advocating, and that's probably the key, is to help our community become more empowered and make better decisions together with their primary care team. Shop for your care. Make sure you're getting the best price and the highest quality where you go. And hopefully your primary care team can help you do those decisions and make those decisions. So overall, we're very happy to be providing and adding value to our community. And please feel free to reach out to us either through our website or whatever contacts you can come by. Our office is located in the 3rd Street Center in Carbondale. You're always welcome to stop by. And I really appreciate all the key stakeholders in this conversation and for each one of the panels. We're going to move over now to questions and comments in the comments. And if there's something I can't answer, I'm certainly going to abdicate to one of our panelists and the experts. Let's see what we have here. So, Michelle, can you comment briefly on, it looks like people are asking about the network and what's included in the network. I know, Scott, you mentioned about HMO versus PPO, but Michelle, if you could talk about that subtlety.
You bet. So Rocky Mountain Valley, it is an HMO product. It is, however, it has, I think, one of the strongest networks that are available up in the Roaring Fork area. So not only are the providers within the Tri-County area all participating, we have access to Front Range Care, so University Hospital, Children's, all of the facilities in the Denver metro area. We're expanding into Routt County for 2022. We've also got networks across other areas of Western Colorado. Grand Junction is available as far as the network is concerned. Montrose, Gunnison, Ouray. So I strongly believe we have got a very comprehensive network. The nuance that you'll see in the Aspen area is Steadman Hawkins is a participating facility in the Aspen area because that is where this product is sold and where the community lives. But we do not have Vail network providers in the Rocky Mountain Valley product. So this is strictly for the areas where our members live. That answer your question?
Thanks, Michelle. Which do you know which plans, Scott, allow for out-of-network coverage?
In the individual market, there aren't any, unless it's an emergency situation. Then you're covered anywhere you go. You don't choose to have an emergency, so if you fall down and break your arm, you're covered wherever you are, and that's not a problem. But if you were to be on an individual policy and want coverage outside of the network, you don't really have it if it's your choice. On the group side, on small group, the level funded plans are all PPO plans or EPO, so you do have a nationwide network. And on the small group, fully insured plans with United Healthcare or Anthem Blue Cross, their HMO version, again, is strictly in-network, no out-of-network coverage. But they do have PPO plans on the group side that allow you to access providers and hospitals anywhere throughout the country. So PPO versus HMO is the key, with PPO being the more robust network anywhere in the country.
Question from Dora, Eleanor Bennett had some questions as well. First, for Sylvia, you mentioned that there is more financial assistance this year. Is that because of COVID or some other reason?
Yeah, it's due to the American Rescue Plan that was passed. They did approve a greater financial portion for those that are eligible. So I would say it has to do with the whole COVID and all the laws that have been passed and the financial assistance, but it is available for those that had coverage this year and those going into 2022.
Thanks, Sylvia. And Michelle, for you, rates and premiums are going down this year. I guess they want to know, what are those rates?
Yeah, and why is that? So, really great question. And it's all based on the experience that we have seen through claims, the type of care that we are paying for over the past year and a half. We're seeing that, and it may have something to do with COVID, that there might have been some suppressed care, but we are seeing lower utilization, and we are achieving savings just through these incredible partnerships we have with Valley Health Alliance, with the facilities and the providers that help to support that lower premium and keep that sustainable. So even if, we see utilization maybe start increasing now that COVID might be lifting and more elective care is being done, we are feeling very confident in our sustainability with the reimbursement rates and just the quality of care that we're getting from our partners.
Thanks a lot, Michelle. Tracy Truelove, she's a sole proprietor. And is there a benefit to working with a broker over researching each provider through our website? I feel like, Scott really said it well. You need to find someone that you're personally comfortable working with, and then how much energy and time you want to put into doing this, or you can afford to do it. I always want to, as our role at the VHA, we want to encourage consumerism, everybody to shop, because that's the best way to drive the cost of care. But we have a great community of brokers that can really help. So if it gets too complicated for you, I encourage you to find a broker that works well with you. But I will never say don't do your own research. I think that's really important for all of us every single day, particularly in healthcare. But Scott, do you have any additional comments on that?
The only thing I would add to that is, and that's very true, and the broker's been doing this, that's their job. And so I would say we have a little bit more information on the things that go on behind the scenes. And also when you're looking at pricing, some people think that if you go direct, the pricing will be better than it is to go through a broker, but it's not. The pricing is set by the state insurance division. So they have the same pricing whether you buy it directly or through a broker. We don't charge you for that service.
Thanks, Scott. That's really important. That's a good distinguishing issue. Wes Boyd asked a really good question. At the beginning of 2021, the small group plans, I guess, Michelle, this will probably be for you, were being discontinued. The Rocky Mountain Health plans that are current, and what are the options for people that less than 15 employees, I mean.
I think I might tag team this with Scott, but yes, the decision was made that Rocky Mountain Health Plans will stop offering group products at the end of this year. So starting in 2022, our focus is going to be on individual and family products, the work we're doing with our Medicaid communities and Medicare. So it's more of a community-driven care program versus working with the employer group. So United Healthcare is doing a great job in bringing more affordable health plans to the small group market. I think you're seeing some lower price products from them, and you'll see that again going into 2022. But Rocky is going to focus again on our individual and family plans, Medicaid, Medicare. The next question, which providers will offer group plans for less than 15 employees? So Scott, I'd like to defer that back to you.
Thanks, Michelle. For fully insured, and that's the Affordable Care Act plans, sometimes referred to as Obamacare, but they're the ones that are guaranteed issue, guaranteed pricing, no changes or anything like that, will be Anthem and United Healthcare, either their HMO or their PPO plans. Those are the two that we have in our valley, and they will be the ones that continue through 2022. If you're also, one of the things that I had mentioned were the level funded plans, and those are the ones that are underwritten and dependent on the health of the whole group could be offered by Aetna, Anthem Blue Cross, United Healthcare has a level funded plan, National General, there are a few others. And if you're in the contracting business, the Contractors Health Trust has one that you can access for people down to 5 or more. Contractors Trust actually goes a little bit lower than that, but mainly 5 or more for the other ones.
Thanks, Michelle and Scott. That's good information, as always. Appreciate it. Any other questions from our audience? We sure appreciate your interest. And yes, I think Sheriff Vincent asked if we were going to have a recording, and it will be available through your chamber websites, also at our website. The Valley Health Alliance does have a Facebook page as well, so there's opportunity for you to get this and to view it again. I think you'll find it helpful, and it certainly has been helpful for me today as well. As we prepare, and since we don't have questions, I'm going to take advantage of having this expert panel here. I'm going to go through and ask each one of you to say, why do you think the VHA is important? Gary?
Oh, I think it's important for everyone in the community who is affected by this to be able to have some input in terms of their healthcare, pricing, solving problems, and that's the unique part of the partnership. We are trying to expand to more employers. We're trying to just look at different ways we can impact affordability and efficiency in the healthcare system and quality.
Thanks, Gary. And Sylvia? What do you think the VHA is of value to our community?
I would have to agree. Nobody knows our community like our employers and everyone here. And to have a voice from those representing our community definitely takes great benefit and helps, like I said, hopefully make insurance more affordable and get everyone covered.
Thank you. And Andrea?
I would say it's just a great opportunity to continue to support all of our businesses, and then also to speak to local live people on the phone rather than a recording. So I think that's great. And then also, in my humble opinion, we make great neighbors. Our office is located on the other side of the wall of the VHA. So I enjoy that as well.
Excellent. And Scott?
I think that the great thing about the VHA right now is working with the local businesses and the insurance companies to bring in options. We didn't, before the partnership with Rocky, we didn't have Rocky Mountain Health Plans. We only had one individual healthcare company in our area, health insurance company. So it brought in competition, it brought in options, and I think that was critical for our clients. And then having the Navigate HMO option with United Healthcare, because we had the PPO plan, but we didn't have the HMO. So we didn't have those price breaks you can get through those. So that type of partnership through the large employers, the large number of people that we have here, and kind of that concentrated effort that the VHA brought forth, I think has been great for the insurance side of things.
And Scott, real quick, Carrie Haberin was asking about how do we find out more about Contractors Health Trust?
Through the brokers. The brokers are working with the Contractors Health Trust, and we can give you information on that, talk to you about plan designs and how you would qualify for that and what's required. So we would be glad to do that with you.
Thanks, Scott. And Michelle, the VHA,
Yeah.
important.
Yeah, thank you, Chris. And, you know, as I mentioned before, I've been lucky enough to be part of the Valley Health Alliance work over the past 2 years, and I've just got to say how impressed I am with really the commitment to the community, the commitment to trying to bring lower, more affordable care, quality care to the people, our neighbors. And really just watching everybody lean in, rolling up their sleeves to do what needs to be done to get these prices more affordable and to bring quality care. So it has been a pleasure working with you guys, and I am impressed with all of the hard work you're doing.
Thank you so much, Michelle. We sure enjoy working with you as well. Scott, another good question. Do the CHT plans tend to be among the lowest rates?
Sometimes it depends on the makeup of the group, the plan designs that you're looking at. There are a lot of times where the Contractors Health Trust may not even offer coverage because of the health situation of the group. So it's always good to shop it out and see what we can get for you. But there might be a time where the fully insured plan with United Healthcare is more competitive, or maybe a level funded plan through Aetna is better. So we would have to just take a look at your current situation and see what we can come up with for you.
Thanks, Scott. Thank you so much. A question from Bill Mitchell says, any chance Vail will join? The good news is we've had many, many conversations, and the better news is they have their own version that they're working on. But we all are definitely keeping tabs on each other in ways that we can collaborate and advocate for their work, because they're doing good work, particularly in the mental health side. I'm very impressed with the level of commitment to mental health, as we do as well. It's such an important piece, you know, the whole person is what we're about. Another good question from Dr. Steve Murphy. As a designated clapper time for a round of applause. Thank you, Dr. Murphy. Appreciate that plug. Anyone else? Any other questions? Any other comments from our panelists? We'll give it a couple more minutes, and then I think if we don't get any more questions, then I think we'll adjourn. I just really appreciate the importance of the Valley Health Alliance is that it takes all of us to make it work. We could not succeed without each person that's here and the groups they represent. It takes all of us to make this a success, and we need the whole community's engagement, either as a consumer or as a participant or stakeholder, to make this sustainable. And that's what we're about, is a sustainable change. One of the origins of the Valley Health Alliance were when two gentlemen up in Aspen sat down and said, healthcare is too expensive, how can we fix it? And they started by looking at those high cost cases and how best to treat those. And we figured that working with primary care is the best way to impact the high utilizer, high cost, and to get people engaged in their healthcare, because that's the only way we can make a difference. Having a primary care doctor is a huge impact on this whole operation, the whole effort. So I encourage each one of you to have a primary care doctor, and most importantly, a primary care doctor that has a team of clinicians that can make your care and experience the best possible. We're striving to make your experience with your doctor the very best it can be, so that you can be healthy and live well and have a good, healthy life. So from the VHA and for each of the panel members, I'm very thankful. And thank you again to each one of you for being on the panel. And thank you for those that have tuned in. And for those that may hear the recording later, we sure appreciate you all, and have a great day.
Bye, everybody.
Thank you.
Thank you.